Welcome to RUMC Connections. Welcome to RUMC Connections. I'm Meredith Gaskins, and today I am joined by Dr. Richard Maggio and Dr. Michael Wilson, the Chief of Robotic Surgery at RUMC. Welcome. Thank you for joining us today.
Thank you for having us.
Thanks for having us.
Today is Team Urology. Through RUMC Connections, you'll meet the doctors, nurses, and medical professionals that help our hospital thrive. We'll provide useful information about your own health, explore the latest medical news, and hopefully get you answers to some of your own health-related questions. Located in the heart of Staten Island, the Urology Services Center is located at 1200 South Avenue and provides advanced treatments and procedures for adult male and female patients. From kidney stones to urologic cancers, including prostate cancer, RUMC's team of experienced specialists offers comprehensive surgical and non-surgical care. The Urological Services Center treats a wide range of urological conditions to help relieve symptoms, enhance comfort, and restore function, most importantly. So Dr. Richard Maggio is a board-certified surgeon who practices general urology and has a special interest in endourology and minimally invasive procedures for BPH, which we'll be talking about today. Previously in private practice, Dr. Maggio recently joined the Richmond Health Network. Dr. Maggio attended New York Medical College in Valhalla, New York. He then completed a rigorous 6-year residency program at New York University Medical Center, where he served as chief resident. Dr. Maggio received diverse training at NYU Langone Hospital, Bellevue Hospital, Manhattan Veterans Administration Hospital, and Memorial Sloan Kettering Cancer Center. In private practice, Dr. Maggio has participated in several clinical studies evaluating new treatments for bladder cancer, stress, urinary incontinence, and overactive bladder. He also offers penile shockwave treatment for men suffering from erectile dysfunction and Votiva RF for women suffering from stress incontinence. Dr. Michael Wilson, our Chief of Robotic Urology at RUMC, is a board-certified urological surgeon who specializes in minimally invasive robotic surgery. He graduated from St. John's University and obtained his medical degree from the University of New England College of Osteopathic Medicine. Dr. Wilson completed his residency at Rowan University, now Jefferson Health in New Jersey, while also spending time in the Virtua, Lourdes, and Inspira health systems. He completed his robotic fellowship at Mount Sinai Hospital in Manhattan. Dr. Wilson specializes in a wide variety of reconstructive as well as general urology and endourology procedures. Prior to joining the Richmond Health Network, he was at Garnett Urology in Orange County, New York. So welcome. Thank you again for joining me today. This is our first urological podcast. And let's let everybody know, when would you guys say that it's time for someone to see a urologist?
In general, men should see a urologist beginning at age 50 to get screened for enlarged prostate, have a digital rectal exam, and a PSA.
Okay.
So that's important, and it should be done on a yearly basis, or any African American 45 or older should have that same screening.
Right. 1 in 7 men would be diagnosed with prostate cancer. If you're of African American descent, it's 1 in 4. Hispanic Caribbean descent, 1 in 5, 1 in 6. The new standards are, at age 45, you get a blood test for a PSA to establish a baseline for you, and Dr. Maggio hit the nail on the head at age 50, the rectal exam along with the PSA. If you're having trouble with urination, whether you're male or female, kidney stones, erection issues, or you just have general questions about your overall health, it never hurts to come and talk to the urologist. We not only do surgical procedures, but we do medical procedures as well to help alleviate those issues.
Now, what would you say are some of the most common issues that you're seeing on a day-to-day basis?
I think for both of us, it's a wide variety. Everything from kidney stones to overactive bladder to incontinence to prostate cancer, kidney cancer, bladder cancer, erection issues as well, elevated PSAs, family history of cancer. Genetics is taking a very high role in any time we talk about cancer in general. kind of encompass everything. I don't know if there's...
I think we're general urologists, so we do encompass everything. We see there's a lot of patients that we see elevated PSAs, difficulty urinating, women with recurrent urinary tract infections or incontinence. So there's a wide variety.
Mm-hmm.
Yep.
And how much of the treatment is done at the South Avenue location? How much is done at RUMC?
Obviously, we first see patients at the office.
Mm-hmm.
What's exciting is that we're now, the office is being renovated and we're going to have a surgical suite in there. So a lot of our stuff that we do in the office, in the hospital can be done in the office.
Mm-hmm.
Right.
Especially minimally invasive procedures that we do.
Yep.
Okay.
And now we also do have a new office location on Highland Boulevard as well. So we have our South Avenue office. We have the Highland Avenue office as well.
Mm-hmm.
So, we're just trying to offer more services to more of the community.
That's great.
And once this suite is up and running, a lot of things that are done in the hospital can be done in our office.
Okay. Now, can you talk a little bit about this BPH? Some people might not be familiar
Sure.
with the term.
So BPH stands for benign prostatic hypertrophy. Fancy way of saying you have a big prostate.
Okay.
Normal size prostate is about what we call 40 grams, or the size of a walnut. Your prostate grows to the day that you die.
Wow.
1 in 3 men are afflicted with symptoms of having a large prostate at some point in their life. You don't have to be over 50 to have the issue. You can be 30, you can be 40. Really, it's the size and the shape of the prostate that really play a role into this. Most of the time, if the wife notices that she can't hear her husband peeing in the other room anymore, it's usually a sign something may be going
It's a
on.
sign. Okay.
You get up more at night to pee, your stream is not quite what it used to be. You're kind of hitting the floor in your shoes more than the back of the toilet. You're running back every 10, 15, 20 minutes. All of that are symptoms of somebody who may be having an enlarged prostate. And as, Dr. Maggio has previously said, bladder health is very important. It's something that has gained more and more traction over the past 20 years because ultimately you only have one bladder. Mm-hmm. And the damage that gets done because of long-term complications from BPH, there's really not a way to fix that.
Yeah.
So you want to stay on top of it. And, when you're having these symptoms, be proactive in it. Not saying that you need surgery or you need anything, but understand and keep a close eye where you are, because if it reaches that point, there are options on the table.
So walk me through a patient's first experience when they come to your office. I mean, how closely do you work with their general practitioners? Or you go through surveys? What does a visit look like for someone?
So really, nowadays with the internet, some patients are referred from primary care doctors. Sometimes they self-refer themselves. But in general, it's pretty standard. Patients come in, if we're talking about trouble with urination, we have a international prostatic symptom score sheet that they fill out. Essentially, it assigns a number to what their symptoms are, and it puts them in a range of mild, moderate, and severe. Now, that establishes that baseline. Then we talk about potential medication options or surgical options. We get imaging of their prostate to see how big it is. We check a PSA to check for prostate cancer, because a lot of men who have trouble with urination have elevated PSAs.
Okay.
An elevated PSA can be elevated for many reasons. The two big guys you worry about are a big prostate or prostate cancer. But the list goes on from riding bicycles, sexual activity that can cause that. Once you do that, we talk about doing tests like a Uroflow or a Urocuff test, which are not invasive at all. Simply, you drink some water before you come to our office and you pee into a machine, and it kind of measures the pressure and the flow. The last part of this, which I think Dr. Maggio would agree that most men are the most concerned about, is cystoscopy, which is where we take a look inside the bladder, and that tells us the shape and contour of the prostate and what procedures potentially may be the best option if we want to go that route. It also tells us the status of their bladder function.
Okay.
So once we gain all that information, it's a conversation that we have with the patient of what options are and what they're comfortable going with.
Mm-hmm. Now, would you use an ultrasound to determine these images?
Yeah, so we can use ultrasounds where they can scan the bladder. With a full bladder, you can measure it. Mm-hmm. Sometimes there are rectal ultrasounds that can be done. If they have an elevated PSA or a previous CAT scan for some other reason, we can measure the prostate off of that as well. If somebody comes in with an elevated PSA, they pretty much all, if capable, get an MRI of their prostate.
Okay.
That essentially allows us to see if there's any specific lesions that we need to target when we do biopsies, but that gives us the size of their prostate as well.
Okay.
For a guy that has a 200-gram prostate and a PSA of 8, that kind of correlates based on their size.
It's definitely important for men 45 to 50 to be proactive and do these PSA screenings, go for their annual visits, and get checked.
Yes, absolutely. Actually, their wives are the biggest referrals, actually.
Make the appointments, wives, yes.
Yeah.
Okay, and speaking of women, so now what age range would you say that you typically see in the office?
Well, we typically see
women?
older women who have problems with maybe urinary frequency, urge incontinence, stress incontinence. Those are the biggest complaints, I think.
Yeah, I think in our office we see young to the old in regards to it. Younger females, usually recurrent UTIs or kidney stones or overactive bladder. But I think as females get older, there are a lot of changes that happen, and that's when they come to see us.
That's when they see us.
Okay. So can you please tell me a little bit about the cysto and urology suite?
So actually, we have in the new ORs, we have a cysto suite. Basically, it's a dedicated suite just for us. It has a fluoroscopy machine because many of our procedures that we do, especially stone procedures or endoscopic procedures, you need fluoroscopy. So it has a built-in unit, and basically we can provide most of our services in that room.
Okay, and for people who might not know, what is fluoroscopy?
Fluoroscopy is live X-ray.
Live X-rays.
So basically,
okay.
we look at the procedure under X-ray while we're doing it.
Wow. Okay.
And then when our office is finished under construction, we'll have a suite in there that will be a procedure suite that it won't have fluoroscopy, but it will be set up as minimally invasive procedures can be done in there, from prostate biopsies to targeted biopsies, urolift, vasectomies, which allows patients, I think, a little bit more comfort than going to a hospital.
Yeah.
It takes a lot of the stress out of going to the hospital just
Absolutely,
because of the rigorous things that they have to do prior to schedule for surgery, but it makes it much easier for patients.
And how long do those type of surgeries typically take?
Typically in the office, typically I'd say less than an hour, probably less than 30 minutes.
Okay.
So that's how you target those to be done in the office. Really, it's a time thing and the complexity of it.
And then what is the shockwave lithotripsy used for?
So shockwave lithotripsy is a way of using sound waves or shock waves that are targeted on a stone to break up stones. It's a big machine. It's a generator that creates a shock wave. It's passed through the body and focused on the stone.
Okay.
And it breaks up the stone into small fragments to help pass it effortlessly.
And what causes these stones?
The biggest reason why people form stones is dehydration. They just don't drink enough. Okay. Some people have, high calcium levels in their urine. Some people have high uric acid levels. But mostly it's diet and hydration status.
When you come to a urologist, when it comes to kidney stones or bladder stones, there's a million different ways about taking care of it, from the shock waves to going in with lasers and breaking them up. And for some people, we have to do surgery through their back to take out the stones. Wow. It's not a one-size-fits-all model by any stretch of the imagination, but the dehydration, we also, if you've had kidney stones, we do metabolic workups for that stuff as well to try to help prevent them. Dehydration is key.
One of the big ones. Okay. And I know that you recently, over the summer, had a trip that you did to Ghana.
I did.
Okay. Can you tell us a little bit
Sure.
about that?
It was something that I actually always wanted to do.
Yeah.
One of the nurses in the hospital went prior, and I asked her to get some information, so I decided to do it.
Okay.
It was one of the most amazing experiences that I've had.
I can imagine.
You have these people in society in poor villages and who are marginalized based on the problems that they had. You help people, and we take things for granted here, but it's really amazing what can be done.
Oh, I'm sure. I'm sure something that we would typically not even consider to be a big procedure would be something quite major there.
Patients there, they have to pay for health care, so they let common conditions get worse and worse. So you had people with huge hernias, can't ambulate, they can't provide for their family, so it's life-changing when you do these surgeries for them.
Absolutely. And how long were you there for?
I was there for about a week.
Okay.
At the hospital for about 4.5 days. We did over 100 surgeries.
Wow. Which type of surgeries? These were all just for the hernia?
I did urologic surgery, but there were head and neck surgeons. There was a plastic surgeon. There was a couple of general surgeons. So.
Okay. And then the other days you were in smaller medical centers?
No, we stayed at that one place.
Oh, okay. Something that you would like to do
I'm gonna
again?
I think I'll go back again.
Yeah. different country, or you want to go back
Probably
to
the same place.
Nice. Okay. Have you ever done any trips like that?
No, I haven't had a chance to as of yet. I know he was speaking very highly about it.
So maybe we'll bring a urologic team the next time.
Yeah, that would be interesting.
My sister is a PA, and she did a trip to Ghana as well and found it to be a very rewarding experience.
It was.
Yes. Okay, so maybe we can talk a little bit more about prostate cancer. How would you say the prostate cancer rates are on Staten Island? Do we have higher than other places, or are we doing well?
I wouldn't necessarily say higher than other places. I mean, it's pretty throughout. Cities always are more densely populated, and with demographics, they always tend to have more patients and more higher numbers in there. The biggest thing when it comes to prostate cancer is screening.
Yeah.
Everyone always has a little fear, I guess, for the rectal exam. There's a general misconception that if you get your colonoscopy, your prostate's getting checked at the same time, and it's not.
Yeah.
I tell patients all the time, listen, if you're fearful of that, you get blood drawn multiple times a year for your primary care doctor, adding another lab to it to check and make sure things are okay. And with the advent of MRIs, which are kind of the standard now when you have an elevated PSA, the invasiveness is kind of curtailed a little bit. I will say there's a lot of cancer on Staten Island with unique pathology, from the prostate cancer to kidney cancer to bladder cancer.
And even testicular cancer.
Exactly.
We've seen a couple of cases of testicular cancer that have been pretty extensive.
But the good part at RUMC, we can take care of that stuff from soup to nuts, no pun intended. For prostate cancer, we have a radiation center that we worked hand in hand with for comprehensive care. We can do the surgical procedures for that. When radiation is involved for prostate cancer, we do something called SpaceOAR, which is a gel that we put in between the rectum and the prostate to protect the rectum from radiation. The hormone therapies, our medical oncologists and radiation oncologists are great. They're literally a block down the street from our office.
Well, that's convenient.
So patients can go from one office to the other really without issue.
Without having to leave the island, too. It's even better.
And then, when it comes to kidney cancer, bladder cancer, testicular cancer, we all work hand in hand in regards to that stuff. But patients can get, everything taken care of at RUMC.
And you were mentioning before that we have an award.
Currently, UroLift, we are a center of excellence for UroLift. UroLift is a minimally invasive procedure for BPH. Dr. Maggio got that title here.
About a year or so ago.
Yeah.
About a year.
And it continues to be a center of excellence for that. When you walk into RUMC, our goal is always to provide a center of excellence, no matter what it is. We try to make ourselves available to patients and answer questions, when we can. The goal is to be patient-centered care.
Yeah. We want to give the best care that we can in a pretty timely manner.
So now, jumping back to some women's issues, say they're coming in for these recurring UTIs or the overactive bladders. Are there surgical options for the overactive bladders, or is this all those treatments, especially like the UTIs, is that medication-based? What do you...
Well, we need to obviously do a workup to see what the cause of the overactivity or the stress incontinence is. Overactive bladders are usually treated medically.
Okay.
We sometimes start with medications. We can do nerve stimulation. There's either a percutaneous nerve stimulation where patients come in weekly to get a treatment to help with that. We also do sacral nerve stimulation, which is almost like a pacemaker for the bladder. What we do is we put a small wire next to the nerve that goes to the bladder, and the stimulation of that nerve causes relaxation of the bladder, so it improves patient's urinary function.
Okay.
And that can be a life-changing thing also. So many women can't tolerate the medications, or the side effects are just so unbearable that they can't take them, and these are other things that we could offer.
And I'm assuming that as men age, you probably see a lot of men for erectile dysfunction?
We do. We
Okay.
do.
Are those predominantly just medication-based, or is there anything new on the horizon?
There are a lot of different things that we could do for erectile dysfunction. Medication is really the most common thing that people ask for.
Yeah.
We have either oral medication therapy, or we could have penile injection therapy that helps with erections when needed. We also do a penile shockwave treatment, which is a treatment similar to kidney stone shockwave treatment, but it's directed at the erectile tissue in the penis. And what it does is it improves the blood vessels, because erectile dysfunction is mostly a blood flow problem. So it improves blood vessels. It causes the release of growth factors, which create new blood vessels and improve erectile function.
So that sounds like a good option for people who may not necessarily want to take a medication, try a different format. So how frequently would something like that shockwave treatment be conducted?
Again, we do surveys on men. We do something called the SHIM score, which is a sexual health questionnaire, and it grades erectile dysfunction mild, moderate to severe based on the questions that you ask. So treatment is geared based on the severity of the erectile dysfunction.
And there are several medications.
There are several medications. There's Viagra, there's Cialis,
Yeah.
which are the most common. Trimix is the injectable therapy for erectile dysfunction.
And how effective is that?
It's very effective.
All depends on the person. As men get older, especially if you have high blood pressure and diabetes, those are your two most common causes for those issues. One thing we stress is we can help treat that stuff, but if you don't have those two under control,
Right.
that's where the primary care doctor, the endocrinologist, the cardiologist, we stress to them, make sure you do your follow-ups with them, because that all plays a role. Everything's connected at the end of the day.
And with the rising rates of obesity in the country, I'm sure that you see more urological conditions because of that, especially on Staten Island with the very high rates of diabetes and things. I'm sure, like you said, all of that has a play on how everything else is affected.
Yeah, I think the biggest thing is sometimes we can put our blinders on and think one issue is one issue. At the end of the day, everything's connected in the body. So if your diabetes is there, well, erections can have issues. And sometimes the first sign that you may have diabetes or hypertension is you have erection issues. Just because those blood vessels in there are so small, they're one of the first ones affected. Usually if they're coming to us and they've never seen anybody before, we get them plugged in with a primary care doctor to check everything over.
I think the biggest thing is that people come to us sometimes with specific problems and they want something targeted to take care of it. They want a pill, or they say, how can I get this better? And what we do is we look at the whole person and we see if there are other contributing factors or other medical issues that may be contributing to their problem. So we certainly send people to, primary care doctors if they don't have them, to get evaluated and help with other problems that they may have.
I'd say that you see a significant amount of men for vasectomies as well in the office?
Yeah, we see, that's a good form of birth control for men. It's obviously, or maybe not obviously, but it's much easier than doing a tubal ligation in women. It's a 15-minute procedure with local anesthesia with very minimal side effects and great results.
And it's something that's done in the office?
Yes, right now we do it in the hospital because of, our anesthesia. That's another procedure that's going to be moved to our office suite.
Yep.
That's great. Okay, well, I'd like to take the last couple of minutes to just get personal with you both. I know it's a stressful job. What do you like to do to decompress? Do you have any hobbies?
I'm in the gym. I mean, that kind of is a way I kind of blow off tension or blow off steam. It helps. And interestingly enough, I just started taking a pottery class, so I'm doing pottery.
Did you?
Yes.
Very cool. Okay, so I would like a nice clay pot, please.
Okay. So you know this, I'm trying to get that ghost kind of thing.
Well, you have
with the wheel.
the surgical hands, so
right.
might be another hidden talent that you discover you have.
We'll see.
You never know.
How about you, Dr. Wilson?
I agree. Going to the gym, spending time with family.
Yeah.
Those are kind of the big things.
Very nice. Very nice.
I don't have a pottery class, though.
No pottery class.
It's actually pretty much fun. It's
Dr.
fun.
Maggio is going to have to bring you along. Very cool. Well, I'd like to thank you both for joining me today and for all that you do to keep us safe and well. If people would like to inquire about more information about urological services or schedule a consultation, they could do so by calling 718-370-1400 or visit www.rumcsi.org. That about does it for this episode of RUMC Connections. I'm Meredith Gaskins.